If we now look at the jejunum and the ileum, well, these are very similar. And many students ask, well, where exactly does the jejunum finish and the ileum begin? And that's quite a difficult question, because there's a very gradual change. There's a clear demarcation between duodenum and jejunum, and that's a sling-like piece of muscle or ligament. And that helps to separate the duodenum and the jejunum. It helps to maintain the duodenojejunal flexure, allowing chyme to pass through the duodenum into the jejunum. But it's very difficult to see a noticeable difference in the transition from jejunum to ileum. But what you can do is you can look at the very beginning of the jejunum and look at the very end of the ileum, and there you'll notice some differences. So here we have from proximal to distal. So we have by the duodenum and by the large intestine, we have the jejunum, and then we have it becoming the ileum. So we can see that with the jejunum, we still have these circular folds. But as we progress towards the distal ileum, we see these circular folds have died down. There's not as much fat around the jejunum. There's slightly more fat around the proximal ileum and more fat still around the distal ileum. The vasculature, the blood supply to the jejunum, is greater than the ileum. So the wall of the jejunum is somewhat pinker than the proximal or the distal ileum. And there's a whole series of other differences which really are a transition from the jejunum through to the distal ileum. And I've detailed some here. So we can see the colour of the distal ileum is quite dark red, and as it progresses to the jejunum, it becomes pinker. The diameter is greater in the jejunum than it is in the distal ileum. I mentioned that at the beginning. The actual thickness of the wall is greater in the jejunum compared to the distal ileum. The blood supply is greater in the jejunum, indicating there's a higher level of absorption that's occurring in this region. The fat in the mesentery, there's more as you progress down into the distal ileum. It's very sparse in the jejunum. Circular folds, there's lots of them in the jejunum. There's few in the distal ileum. It's a lot flatter. And lymphoid nodules, there's few in the jejunum, but they increase in number, forming these aggregates in the distal ileum. So we can see that it's very difficult to actually pinpoint a specific region, especially halfway at this kind of proximal ileum region, and say, yes, this is definitely jejunum, this is definitely ileum. But there's a transition from the duodenojejunal junction to where the ileum merges with the large intestine. There's a transition which is indicated in these descriptions.